Hello, everyone. Thank you for joining us today for the Canadian Liver Foundation and University Health Network Ajmera Transplant Centre, a quarterly webinar series on liver disease and liver transplantation. My name is Nem Maximovich. I'm the Senior Manager of Support and Education at the Canadian Liver Foundation, and I'll be the moderator and host for this webinar. I would like to start by acknowledging that the Canadian Liver Foundation's national office in Markham, Ontario is situated upon traditional territories of the Anishinaabe peoples and of the Haudenosaunee peoples covered by the Upper Canada Treaties. The Ajmera Transplant Centre and Centre for Living Organ Donation at UHN, located on traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and now home to many diverse First Nation, Inuit, and Métis people. This is the second session of our quarterly series. In our first session, our speakers discussed liver disease, clinical management, and treatment options for liver failure. In today's session, our panel of speakers will discuss the UHN liver transplant program, living donor transplant program, pathways to liver transplantation, why living donors donate, the donor assessment process, as well as the surgery and recovery. We will also have a special patient speaker discussing their stories and sharing their stories with us today, along with a Q&A at the end of the session. We are joined today by a panel of speakers. We have Dr. Nazia Selzner, a transplant liver specialist hepatologist in the multi-organ transplant program at UHN and associate professor of medicine at the University of Toronto. We also have Chantal Wiggins and Elena West, both transplant coordinators at the Ajmera Transplant Centre Living Donor Liver Program. And lastly, we will hear from our patient partner and liver transplant recipient, Jefferson, who will share his story with liver disease and transplantation. So please feel free to use the comment feed in the Facebook Live to ask your questions during the presentation. And please do note that questions will be answered following all the speakers' presentations. If you are unable to catch this presentation live, rest assured the session will be available post-event following this live event on both the Canadian Liver Foundation and Centre for Living Organ Donation Facebook and YouTube pages in the coming days. At this time, I'd like to welcome our first speaker, Dr. Nazia Selzner, a transplant hepatologist. Dr. Selzner will be providing us with an overview of the UHN transplant program, some common types of liver diseases requiring transplantation, the liver transplant assessment process, and the pathways to transplantation. Dr. Nazia Selzner, I'll hand it over to you.
Yes, good evening, everyone. And first of all, thank you to Canadian Liver Foundation for this, for organizing these webinars, and really happy to be able to here tonight and talk about liver transplantation, and most importantly about living donor liver transplantation. Before we dive into the living donation side, just a few words about our Ajmera transplant program at UHN in Toronto. So we are the largest liver transplant program in Canada with excellent long-term patient outcomes. We have done over 1,000 living donor liver transplantation programs since the program started back in 2000. So this is now over 22 years of experience that we have in living donor liver transplantation. We follow up and provide care to over 2,000 patients across Canada with liver disease and liver transplantation. And we also have a track record of groundbreaking research, advancing science, and improving care of the patient, as well as providing education to the new generations of trainees in liver disease and liver transplantation. There are also compassionate experts working very hard at Ajmera Transplant to do what is best possible outcomes for each of the patients. Very briefly, I know that this has been discussed during the previous educational series, but just to set up the stage maybe for the next few slides, the common type of liver disease for which a transplantation is needed and definitively is offered in our program includes various types of hepatitis. So we are talking about viral hepatitis in particular. We provide liver transplantation, and liver transplantation is definitively an indication for patients with non-alcoholic fatty liver disease or NASH that have reached to the end stage of their disease. Cirrhosis related to alcohol, previous history of alcohol misuse is another indication for liver transplantation. Autoimmune diseases, including primary sclerosing cholangitis, primary biliary cholangitis, and autoimmune hepatitis are another category of diseases for which liver transplantation is an indication. And finally, cancer of the liver, hepatocellular carcinoma, as well as some particular form of cancers that is originated from the bile duct or cholangiocarcinoma, are other indication for liver transplantation. Some of these are done as part of a research studies, but definitively provided as possible transplant indication here at Ajmera Transplant. The journey of a patient with end-stage liver disease starts with a referral. The referral form here is on the slide. You can see it. That comes from their primary specialist, gastroenterologist or hepatologist, often also sometimes through their family care provider or their GP. These referrals come for example, to our program, and then goes through different stages. As a first stage, the referral is reviewed by one of the transplant hepatologists to ensure that the patient meets and actually has the criteria to receive a liver transplantation. And upon that initial review, the referral is processed, and often the patients are then booked to be seen by one of the transplant hepatologists in our liver assessment clinic. At that stage, they are assessed. There are the history is taken. Their previous conditions is all taken in their consideration. And if they are seemed suitable and meeting the criteria to move ahead, they are put into what we call the assessment for transplantation, which is the next step. From there, they go on to do some of the testing to ensure that they are otherwise suitable from other organ system. For example, they don't have any major cardiovascular disease that could be prohibitive for a liver transplantation. Once all those testing are done, the group reviews all the testing, the indication for transplant. We discuss every single patient at our multidisciplinary weekly meeting and review all the testing. And if the patient is clear through that multidisciplinary testing, then they are put on the waiting list for transplantation. Also, once they have received the transplant and they are discharged home from the hospital, the transplant hepatologists continue to provide care to those patients in the ambulatory setting for their lifetime. There is, from the time where a recipient is put on the waiting list for transplant, there is what we call two pathways to transplantation. So every single recipient, first of all, has to be listed for transplantation, has to be on the what we call deceased donor liver organ transplant list with the Trillium Gift of Life network. And at that stage, if a recipient has the possibility to have a living donor liver transplantation, if they have donors that are available for them, we are willing to accept and start the assessment of a living donor. And two of my colleagues are going to talk very shortly to you about how that assessment takes place. But basically, that starts from the moment the recipient is listed for liver transplantation. If obviously a recipient has no access to living donation, or for any anatomical reason, they are not suitable for a living donation, they remain obviously on the list for a deceased donor organ until that organ become available. This is a slide that shows basically the unfortunate condition in Canada, but also around the world, indicating that we do not have enough deceased donor for all the patients in need for liver transplant. And every year there are a number of the recipients who are listed for transplant die on the waiting list for liver transplantation. For example, you can see here, this is Canada-wise numbers, that about 100 patients die roughly every year. We use a percentage quoting of about 20 to 25% death on the waiting list on a yearly basis for recipients who are waiting for transplant with a deceased donor organ, simply because there is not enough organs available. With this, I'm going to pass it on to both Chantal and Elena to talk in more details about living organ transplantation at our center.
Thank you, Dr. Selzner. Thank you for having us tonight to explain a little bit more about living donation. We're happy to share some of our expertise and knowledge with everyone. So living organ transplantation is a common treatment for liver failure in many parts of the world. There's been over 6,600 living liver transplants worldwide in 2020. Why consider living liver donation? What are some benefits? So it's life-saving with minimal wait times, meaning that when you're waiting for a deceased donor offer, times are very unpredictable. Recipients will never know when they're going to get that call, which causes a lot of anxiety. With a live donor, there is a lot less waiting. The average is around 8 weeks, sometimes even up to 12 weeks. But in comparison with deceased offers, it can be much quicker. And this obviously varies on each situation. Sometimes it can be longer, sometimes it can be much quicker, depending on the medical status of the recipient. And it's also a scheduled surgery. So a live donor is an outpatient. They come in the day of surgery, and we give them a surgery date as well in advance as we can, usually minimum about a month in a non-urgent case. And that date is also given to the recipient, usually 1 to 2 weeks in advance. Sometimes that information is shared earlier if the donor has a direct relationship with the recipient. So it helps ease with that anxiety of when they can go to surgery. For donor recipient, there's a faster return to good health, good quality of life for the recipient, of course. Better long-term outcomes, better quality organ. Obviously, our donors go through a very rigorous assessment, which I'll describe later. And donors gain a deep satisfaction from saving a life. It's life-changing, life-altering. We have a lot of wonderful stories speaking to our donors after, at their follow-up appointments, at how much their outlook on life has changed and what this donation has done for them, which is really special. Why do some living donors donate? Why are the reasons that people want to do this big surgery? So connection, obviously, to a recipient, connection to transplant, either maybe they've heard of UHN, or sometimes we've even had staff members or other hospital members apply. A connection, obviously, to recipients is number one reason, family member, community member, spouse, child, etc. The list goes on. They want to help or do something meaningful. So we do have a really big anonymous pool of interested donors who want to do this to help someone they have never met and never will meet, which is very remarkable, very special. And they're a whole different group of people that bring a lot of joy to us. They appreciate their own good health. So obviously, being a donor, you need to be in the utmost health and fitness, and they want to give back. they want to save a life, they give the gift of life, sorry. Many of our donors also donate blood, they volunteer in the community, they have a sense of responsibility in helping others. Sometimes there's no other option, and people will step forward to save a recipient's life. The good news is the liver does regenerate. The liver is an amazing organ, and the cells do regenerate within 3 to 6 months. The missing piece of liver will have new cells and be a full functioning liver. You may be wondering if you can donate and how you can become eligible. So you do need to be between the ages of 16 and 60 years of age. If you're interested in anonymous donation, we do recommend under the age of 55. We expect people to be in excellent physical and emotional health, which will be reviewed on the health history, which we'll explain in detail later. Your liver needs to be healthy, and normal liver function, which we check with blood work and the imaging that I will also describe later that all donors have to complete. You need to be a healthy weight for your height. And you can look at this, if you Google BMI calculator, you can enter your height and weight, and it will tell you what your BMI is. To go to surgery as a live donor, your BMI should be 30 or below. If it is above 30, between 30 and 34, we do have assistance with a weight loss program. Unfortunately, if the BMI is above 35, we cannot start an evaluation, and we would ask that you work with your family doctor or by yourself at home, increasing exercise and increasing your diet to optimize your weight. You do need support from family and friends. Everyone does need to have a support network because you will need assistance during this emotional time and also in the recovery. And you have to be doing this voluntarily, so no coercion or obviously being forced. Compatible blood types. So a donor does need to be compatible blood type with the recipient. And you can see this chart here. It kind of seems confusing and a lot of information, but it kind of describes in each column. So I will just touch base on two kind of main ones. O is the universal donor blood type. So you can donate to anybody of any blood type. And AB, those recipients can receive a donor, a liver from any blood type. The positive and negative, some people say, does that matter? No, it does not. So if you're O positive, you don't need to donate to another like O positive or O negative. That part does not matter. And Elena will be speaking later about how to get your blood type. Who cannot be a living liver donor? So persons younger than the age of 16 or older than the age of 60. A confirmed type of type 1 or type 2 diabetes. History of cancer. The only cancers that aren't included are the squamous cell or basal cell carcinoma. So those are types of skin cancer. Those are fine to proceed with an evaluation, but unfortunately, any other cancer history, we cannot move forward with an application. Touched again on the BMI, so greater than 35, we are not able to go through to an evaluation, and we would recommend weight loss, and people can definitely reapply, and we've had many donors do that in the past. A history of heart bypass surgery, heart attack, cardiac stents, or stroke also excludes you. And there's a lot of other factors that aren't on this list, but if we have a concern with your medical history, the nurses review all the health histories along with our medical and surgical team, and we will connect with you by phone to advise if you're suitable or not based on your health history. And if you're not, we will explain why. And it is for the safety of the donor. And this brings us to the next very important slide. So donor safety is our #1 priority. We cannot rush through an assessment or skip any steps. All our donors go through rigorous testing and consultations, not only for their own safety, but the safety of the recipient. And this includes emotional, psychosocial, and surgical and medical risks. Everything will be very clearly explained to the donor from multiple people on our team. And that is to protect the donor, make sure they feel that they understand every last bit of information. So we never rush a donor. We never make a donor go to surgery. It's all in the donor's hands of their comfort level. And we have a wonderful team who really takes care of our donors to explain everything really slowly. And we allow them to take their time with their decision. That being said, only 1 in 5 people who apply to be a liver donor at UHN are cleared for surgery. So meaning 4 out of those 5 are excluded, and it can be multiple reasons. And I will be speaking shortly about the assessment process, but if you are excluded, we will obviously explain those reasons why, and there are multiple different reasons, which I'll get into in the next slide. So the living liver donor assessment process. So as I mentioned, it's a rigorous assessment, and it can take up to 4 to 6 weeks to complete. Now, the first step, if you're wondering what do I do to begin this process, is you need to complete the health history medical form, which is found on our website, and we will also give you information at the end of this presentation. The health history is very lengthy, and there's a lot of questions, and those need to be completed in full, along with your blood type. And you can request your blood type from your general practitioner if you have an old record. We've even had people submit their baby record from when they were an infant. Or if you have donated blood and you have a donor blood card, sometimes people even show us their app, a screenshot on their app, and all those types of proof are acceptable. But that is really important and needs to be submitted at the time of the health history. We cannot start a donor unless we know that there's a blood type match for safety reasons. Once that comes in, it's processed. You will receive an email thanking you for your application and briefly describing next steps. The nurses and, as I mentioned, surgical and medical staff will review your health history. And if you are suitable, we will call you to do an interview on the phone and describe the process, make sure that you're comfortable in proceeding with phase 2. If you're not suitable, so if just say you have type 1 diabetes, we would call you and explain, unfortunately, thank you so much for your generous offer, but we cannot move forward for your safety. We will have to close your file. For the people who are consenting to move on to phase 2, we usually do phase 2 and phase 3 in kind of one section of time. So we coordinate an MRI and a CT of the abdomen. So these are diagnostic imaging, and this will assess your liver. So it's looking at the health of your liver, the size of your liver, and the anatomy. And these are all really important pieces for the surgeons and the medical team to make sure that you are a right fit for the recipient and an appropriate surgical match. Also, sometimes we order echo stress tests, so that's cardiac testing for the heart if you're over the age of 50 or if you've had previous smoking or any other concerns with the heart, we would order this. Pulmonary function test is a breathing test that is used to determine asthma, and we will sometimes order this test if required. We will also coordinate visits virtually at this time with donor coordinators. That's myself and Elena, a donor physician, and a lot of blood work. So it's around 17 vials of blood. We test for all infectious diseases. We look at your liver, make sure that's healthy, your complete blood count, make sure you're not anemic. We're looking for any concerning findings. And then an ECG, so that's an electrocardiogram. That's a heart, also a heart test, a simple test where they put leads on your chest and they're looking at the heart rhythm. And then a chest x-ray to look at the lungs. Then after this, phase 2 and phase 3, we sit down as a surgical team and we review all donors to ensure that they're safe to proceed with all this information in front of us. And then you will be notified if you're suitable or not. If you're not, obviously that's very difficult news to hear when you're trying to help a loved one. And we are here to support you during that time. For the people who get to move on, it's obviously a very exciting day for them to have this amazing news and relief that they can help someone in need. And we move on to the pre-op phase, which includes phase 4 and 5. This is how we prepare you for surgery. And you will need to see a psychiatry team member, social worker who will help with supports, talk about Trillium Gift of Life programs to help with donor reimbursements for costs, which we'll explain a little bit later. You have a surgical risk assessment with one of our surgeons and an independent medical consult. So the medical consult will review your whole chart to ensure everything is safe. And then for preparation for surgery, you will have pre-op education. You will come meet our team in person. You have pre-administrative things to cover with pharmacy, anesthesia. And then once that is all completed, we will book your surgery date. And when the big day comes, the surgery starts, the check-in process at 6 a.m. So very, very early morning, and you'll be in surgery for 6 to 8 hours. And then you'll be in the recovery room for a few hours that evening. And then you will remain in hospital for about a week. I'm going to pass it on to my colleague, Elena. Thank you so much, everyone.
Hello. So in terms of risks of living liver donation, so it is a major abdominal surgery. 1 in 4 living donors at Toronto General do experience some complications. However, most of these are mild and temporary. Some of the more moderate complications, though, that donors can experience are bleeding, abscess or fluid collection, blood clots, and wound incision hernias. So to date, we've had over 1,000 donors go to surgery, and we've never had any deaths in our program. So there's a lot of care involved after your living donation, which we would arrange for you. So as Chantal mentioned, our donors are usually in the hospital for about a week. While they're in the hospital, it's the inpatient liver team that's following them. And then after they've been discharged, our team kind of begins following them again. So usually around the 2-week mark after surgery, or about a week after you've been sent home, we have a transplant coordinator check-in. So either myself or Chantal would give you a phone call and check in with you just overall how you've been doing with your recovery. So we check in, we want to know how your appetite's been, how your mood has been, how your pain is, how your incision is, basically just anything. Of course, if there's any issues or concerns before, you're always welcome to call us or email us anytime. We're always available to chat. Around the 1-month mark, we will send you a requisition to do some blood work locally at Life Labs. And then we would also arrange a virtual call with the surgeon to just check in on you and see how you're doing with your recovery. Usually around the 6 to 8 week mark is when donors do start to kind of resume their normal activities. So usually we tell most donors they should plan to be off work for 1.5 to 2 months. Now, sometimes if donors have a job that's more flexible, so let's say they work from home, they are able to sometimes start resuming some activities a little bit earlier. But if you do have a job that's more physical or strenuous, we recommend up to 12 weeks off of work. So around the 3-month mark, that's kind of when most donors resume most of their activities. That's also when we arrange kind of your final check-ins. So we would send you another blood work requisition to do locally. You would also have an MRI, which would just kind of monitor for any complications. And then we would also arrange for you to speak with our transplant doctor. So that's Dr. Selzner. And then if at that point, if all is well and there's no complications or concerns, we would send all of those reports to your family doctor. And we ask that they follow up with you yearly for the next 10 years and just monitor your liver enzymes and your liver functions and your overall health. We also arrange another virtual call with Dr. Selzner at the 1-year mark. And if there at any point, if there's any concerns with your liver health, we always say to reach back out to our office, and we are happy to arrange follow-up as needed. So some important timeframes to consider with living liver donation. On average, the workup does take anywhere from 4 to 6 weeks. Although I think, as we've mentioned, there are some situations where this would be much faster. So if the recipient is more urgent, the recipient team would inform us, and we would be able to expedite the donor workup. So the fastest we've ever done a donor workup is in 24 hours. However, this, as I said, it's an emergency situation, and so it's definitely not the norm. On average, from receiving the donor application to proceeding to surgery, it's about 8 weeks. Although that being said, it varies for everybody. Every case to case is different. and the median is 94 days for anonymous living liver donors. So especially in the case of anonymous donors, we always try and work with them to find a time that would work well for them. So even if the evaluation's finished, if you as a donor feel that for your own personal life or your like whatever commitments you have, you aren't able to proceed to surgery right once we've cleared you for surgery, we work with you to find an OR date that is suitable for you and your life. As Chantal said, you usually are in the hospital for about a week. So anywhere from 5 to 7 days is kind of the average. If you're donating to a pediatric case, occasionally your hospital stay will be closer to the 5-day mark. But if it's an adult recipient, then usually your hospital stay is closer to the 7-day mark. And as I said, many donors do return to work within 6 to 8 weeks, unless your job is more physical or demanding, and then you should plan to be off for about 12 weeks. So some practical considerations for living donation. In the case of a directed donor, we can only begin living donor assessment once the recipient has been referred to UHN and is determined to be eligible and on the liver transplant wait list. So if we receive a donor application and the recipient hasn't been formally listed yet, we would just hang on to that application and give you a call and let you know that once your recipient is listed, we can definitely begin your evaluation. And just so you're aware, the donor team and the recipient team are separate. So any information that we have about the donors are not shared with the recipient, and vice versa, our team doesn't receive any information about the recipients. We also only assess one donor at a time. So in the case where there's multiple donors that step forward, our team would review and determine who would be the most suitable. So that could be based on different factors, based on size, on health, on age, and if the family maybe decided they had a preference that they wanted someone to go first, to be the first person to step forward to do the testing, we would definitely take that into consideration. We try and always arrange testing for the donor's convenience. Sometimes it's, of course, not possible, but if a donor was unable to come to Toronto at a certain time, like 1 month doesn't work for them, we always try and kind of coordinate with their schedules because it is obviously a lot of testing and a lot of commitment from their own life. So donors do need to travel to Toronto for their imaging. Now, in the case of out of province and out of country donors, occasionally we'll work with the family doctor and we'll send them a request and say all the testing and blood work, the CT, MRI, as Chantal mentioned, that needs to be done. But it is our preference to have it done at Toronto General, because oftentimes when it's done elsewhere, it does need to be repeated once they're in Toronto anyways. Also, in the case of the out of province and out of country donors, the recipient's provincial health insurance plan, so the recipient's OHIP, actually covers the cost of all the testing and the surgery for the donor. So the donor won't be paying for any of the imaging or their hospital stay. Living donors are eligible for financial reimbursement for most out-of-pocket expenses, such as travel and accommodation. So we do have some programs in place that will cover the cost of flights, hotel stays, and even some loss of wages. So 95% of living liver donors would donate again. And I think this just is really telling that most of our donors do have a really positive experience. And in fact, some of our living anonymous liver donors have gone on to donate kidneys. So how do you become a living donor? So you can log on to www.uhnTransplant.ca. You'll complete the health history application, which Chantal said is a long 12-page form, but we do need it filled in fully. And we also do need a proof of blood type. So as she said, it could be a blood donor card or blood work from your GP or anything just stating what your blood type is. If you are a match, so once our team has reviewed and determined your blood type match, your health history is suitable, we will give you a phone call and begin the process of evaluation. And that's when you would then undergo a comprehensive assessment and we would determine if you're able to proceed to surgery. So in terms of finding a liver donor, there's a lot of different ways. I think most people do start with their inner circle, so their family and friends. However, if you don't have any family and friends that are able to be a donor, or maybe they're not a match for you, definitely there are other ways. So you can reach out to your community and even strangers. So a lot of times our recipients will start campaigns and we'll get a lot of anonymous directed donors. So people that have just seen something and heard that someone needs a transplant and they want to help. And we get a lot of different Good Samaritans and people that just want to do something meaningful. So there's always a way to find a liver donor. Some useful resources. So every year we do have Living Donation Week. So this fall we'll have one, and you can register at Eventbrite for it. And there's lots of peer-led workshops for liver transplant candidates. And the Center for Living Organ Donation always has a lot of good resources as well. So who to contact? So if you're a recipient, it's important to contact the liver transplant clinic. The pre and post transplant coordinators are really good resources. And you can look up at uhnTransplant.ca. If you're a donor, you definitely are welcome to reach out to our office. So that's the Living Liver Donor Office. And our email is the best way to reach us, livingdonorliver@uhn.ca. And for both donors and recipients, they're welcome to contact the Center for Living Organ Donation, which has a lot of education, and there's peer mentorship for donors, recipients, and caregivers. And they can be reached at livingorgandonation@uhn.ca. And now I'm going to pass it on to Jefferson to talk about his experience with transplant.
Awesome, thank you. I'm honored to be here today as part of this wonderful team and to give back a bit. My name's Jefferson Hall, and on July 30th, 2020, I received 63% of my friend Tim Marshall's liver. One of the miracles of modern medicine, and equally important, a miracle of human kindness. Today, or tonight, I'm going to provide a little bit of background, then focus on getting on the transplant list, navigating the liver donor process, and I'll speak a bit about post-transplant life. Unfortunately, Tim, my hero, could not make it here today due to a scheduling conflict, but if I have time, I'll try to shed some light on his piece of the journey where appropriate, and I'll aim to leave some time for questions. My background is I have a liver disease called primary sclerosing cholangitis, PSC for short. It attacks the bile ducts. So PSC and underlying ulcerative colitis were diagnosed in me in 2001. But if I reflect back, the symptoms could have been as early as 15 years prior. Adding complications and excitement to this is I have hemophilia. Thankfully, it's mild, but not mild enough. Regardless, my story is I knowingly and comfortably lived with PSC for 20 years, possibly longer. And basically all I had to do is have a modified diet, careful about what I eat and drink. I took Ursidol, and basically I lived a normal life. I'd see a liver doctor annually, eventually. It was semi-annually at first. And I'd ask each time, what can I do? And the answer was keep with that diet. And one day, maybe 20 years, it's funny on that time because that's what it was, you'll need a transplant. He said, watch for jaundice, have semi-annual blood work. And so to me, D-Day seemed very far off. I led an active life, had a lot of physical pursuits, sailing, skiing, running, biking, swimming, you name it. We started a young family. Basically, my wife and I forgot about my issues, PSC, and the only time it came up is I couldn't get life insurance. Very few people knew there was anything wrong with me, and life was rolling along really well. Everything was fine until it wasn't. Sometime, I'll call it March 2019, I was feeling drained, started to drag, went on family walks. It kind of teased me a bit. I couldn't keep up, was tired, had indigestion, bowel issues, wasn't feeling great, didn't really know what was wrong, but I didn't associate with PSC. I'd peer in the mirror looking for jaundice, there's nothing there. But as I progressively felt a little worse and worse, I started booking appointments with my various specialists to see what was going on. At this point, waiting for an appointment was probably a couple days or weeks away. One night I looked down at my legs and they weren't mine, they were massive. I had the swollen lower body of someone else. And I told my wife, Tracy, that it was time to go to the hospital. Yet still in the mirror, no jaundice. So I still wasn't thinking PSC. All sorts of tests and then blood work showing crazy high liver functions, probably 10 times the upper limit, dangerously low hemoglobin, half of what it should be. I found out I'd been bleeding internally for months due to some varices. So at this time, things went from bad to really bad. I was having hospitalizations, possibly monthly, sometimes twice a month. We knew it was time for self-advocation. And I actually had to admit, what was wrong really was wrong. Thankfully, I had my wife, Tracy, my champion, my cheerleader. She reasoned with me that we must admit where this trajectory is headed. I needed to be there for my family in the future, so we needed to make a plan. We sought out mentors, people who've been down the road before, could talk to us about the journey, find out what they went through, what the timelines were like, so we could be prepared. We spent time learning everything we could about livers and living with PSC, transplantation, and sought out the best care possible. Tracy found videos of information from Dr. Gideon Hirschfield, and one day came running out to tell me that he was speaking at a patient group that afternoon. I wasn't thrilled or ready to admit that I was ill, let alone mingle suffering people, but I knew my wife was right. And so I went and I pulled Dr. Hirschfield aside before he talked. After a 10-minute conversation with him, I knew we needed him and I guess this UHN team in our corner. During the appointments with Dr. Hirschfield, we discussed time horizons, and he stated, well, each case is different, as we'll all find in this journey. And there's nothing certain. My runway was maybe about 24 months, and tailwinds could accelerate these things. So hearing you might have a 2-year runway is not something anyone wants to hear, and causes immense focus. And thankfully, in my case, no panic, because I had a great planner in my corner. So due to my heavily scarred liver causing portal hypotension, which is back pressure, my bleeding disorder added to this and heightened the risk that I had of bleeding and returns to the hospital, and ultimately lowered my quality of life. So at this point, my next step was to meet with the pre-transplant team. I think it was spoken about here earlier, vials and vials of blood. This is at the UHN, where I started to meet this incredible team for the first time. I met Dr. Selzner, wonderful lady, great to see her again. She's still my doctor, pardon me. So with the assistance of the transplant team at UHN and my new hepatologist and hematologist, I made it to the transplant list on February 1st, 2020. It's quite something when this is your goal, is to get on a transplant list. But I knew that having a living donation was probably my best chance for the best medical outcome. And I knew I ultimately needed this transplant. So here we were lobbying to get on the list so we could have targeted donations come in. And as PSC doesn't usually present a high MELD score, which is what's used to rank where you are on this transplant list, let's call it 200-300 people, I was really counting and needing a live donation. With an accelerated timeline, I wanted as much runway as possible, as if I could control something. Anyway, all the benefits they mentioned earlier around a healthy liver, timed surgery, these are the reasons to go for the live transplant. I think you heard earlier, it takes up to 6 weeks to work up a potential donor, and being aware of that and complications around it and scheduling. And I think they suggest with the matching ratio, you need up to 8 donors to get a full match. So that's 8 with the same blood type in my case. And knowing you can only work up 1 donor at a time, this process could mathematically take up to a year, maybe more, maybe less. So time was of the essence. Post-transplant, I've met someone who had 20 plus potential donors worked up and no matches. I mean, everyone's case is different, but she ended up getting very sick and got a cadaver, and maybe that's not relevant because we're talking about live donor, but my recommendation is you get the word out wide and well and be prepared for your journey. Tracy created a website and pre-prepared an email and a distribution list ready to launch that very day that I was put on the list. This mail out asked people for help. It provided instructions on how to apply for a targeted donation. And at this time, it was incredibly humbling for me. It felt wrong asking for help. I never need help with anything, or I never want help with anything. But with such low MELD score and my bleeding complications, it really seemed the only way to guarantee my future. At this time, there were all sorts of emotions, not being worthy of donation, or someone undergoing major surgery for my gain. There were even thoughts of wondering, well, what if no one answers the plea? Do I deserve this? So many thoughts are in and out of your mind at this point. But I can tell you now that others will help. Trust humanity, but get your case in order. I was fortunate enough to have friends, family, acquaintances, strangers even, who came forward to be worked up as potential donors, or at least put their names on the list. And many who simply helped spread the word. As one sample of that is a principal at my son's school posted the story weekly in her newsletter. I had a friend who put it on Facebook daily. I was truly humbled. And I think we're very fortunate in this day of social media. Time on the list, it's a touch unbearable. You know, the team, for very valid reasons, as they said, they keep the sides segregated. They won't share anything about donors or where in the process they are, but they will tell you if someone's being evaluated. Potential donors are able to share with you, but the hospital won't. So be patient. I understand that there is a process and that it's working, it's being followed. Just be patient, but be diligent. So the better prepared you are before you get to the stage, the better you can maximize your runway. At this point, I'm gonna pause and I'll speak in Tim's voice or his perspective for a minute, because we had a conversation today, because it kind of fits into the timeline here. I believe he and his family were returning from a holiday when they got this email I alluded to, and being a selfless, wonderful person, he discussed it with his wife, and my understanding is he applied right away. This would have been the February 2020 timeline. I really don't know the particulars of the process, how it went, but in March, he did come to my house and he shared with my wife and I that he'd put his name on the list. And he did this so I would have some hope. You know, and as I said, I spoke with him today. I just asked him about that decision. And he said the biggest thing there was the when and the how to tell me, because rightfully so, as a program stresses, they don't share anything. And he said that, you know, this was his moral dilemma. He wanted to tell me, you know, not looking for a pat on the back, and also worried about the impact if something went awry and it didn't work, or maybe even, let's say he couldn't do it or didn't want to do it. But he said he pictured me waking up every day, pardon me, and the agony of not knowing, and decided that he had to tell me because it's almost inhumane. Pardon me. So I remember that day, obviously, with huge emotion and not knowing how to thank him, and I still don't, but I do every day. I thank him almost and call him up when an event happens. Anyway, where am I going? So I was very fortunate that I had a kind friend who came forward, who put his name out there. And I was even more fortunate that with him willing to be open about it, I was in the loop. So during this time, Tim did his research. He spoke to the transplant surgeon friend. He talked to some peers who'd actually done it, who were quite active. And this was very important to him because he's a very avid cyclist, very active, incredibly fit. And he wanted to make sure that he wouldn't impact his future health and capabilities. And ideally, as fate would have it, this also made him an ideal potential donor. Anyway, moving forward, sometime in the spring of 2020, they completed his assessment. He was deemed a perfect match. And I'm not sure if that's a clinical term, but it works for me. And thankfully, he let me know and kept me posted on the timing moving forward. And if I can speak for him more, I believe his recovery was wonderful, but with his competitive nature, he was aiming to beat the discharge record of 3 days, and I think it was a couple of days longer, so he wasn't thrilled. But I do know he was in good health and still is, as he arrived at my door riding his bike like literally the day after I got home from the hospital, a few mere days after he was discharged. So I know he wasn't supposed to, but I'm certainly never going to tell my hero what to do. And if I may do one closing part in Tim's voice on his behalf, I know that he is proud to be an advocate for living donation, and he's already had an impact. I know one person who's a lady who's given her kidney to her sister after conferring with him. So it's great to have these stories, successful outcomes, and pass it forward. I'm just going to pause for a second. At this point, I'll just give a little bit about the transplant post. You know, it was really tough going into the hospital, walking away from my wife and one crying kid and not knowing what would happen. But I will say that that UHN team is top notch, and I don't believe I was ever concerned for my well-being, and I certainly never wondered about my level of care. You know, my recovery in the hospital wasn't too bad, honestly, after this major surgery. I was off pain medication quite quickly. And I'd say the toughest things were getting used to the medication and the difficulty I had sleeping, mostly as a result of the medication and being in the hospital. You know, I was up and active trying to get out as quickly as possible. They say it's generally up to 2 weeks. I think you could be in there post-surgery. Thankfully, I was in only about 1, as it felt really long at times, and especially after my friend Tim got to go home and we couldn't have any hallway visits anymore. The first 3 months post-recovery, you see some great pictures here of us. You know, we used to take cupcakes to his family every month, and he deemed this was too frequent, so we dialed it back a bit. But the first 3 months were great, and I started thinking about going back to work. And then I had some complications, you know, a number of returns to the transplant ward, my new family. My case was due to some scarring in the common bile duct, and I think this is, let's call it a 25% chance in a living transplantation that this happens. But I got the lucky 25, but I'm lucky that I had everything else. So, you know, I could have been disheartened, and I may have been slightly so at times, but I understood and I knew that there were going to be good days and bad days, and everyone's journey is different. And I'd offer the following sage advice that I got from one of my mentors, who's about 15 years post-transplant right now. He said he got it from another mentor passed on, and he basically said, you know, don't let the lows get you down, as the highs will always return, because you get elated with this gift of life and you're feeling better again, and complications can come, but the team can deal with it. You can deal with it. So just keep fighting. Right now, I'm 23 months post-transplant. I've had the last 12 months have been fabulous. It's funny, I was looking back at photos the other day and I saw that 2019 to 2021 was this roller coaster. It'd be great times with the family. I'd be in the hospital. I'd be skiing. I'd be in the hospital, and then this just would repeat. And at times it feels awful, but you know, there's this too shall pass, as another mentor has told me. Regardless, after numerous trips to the hospital to deal with these complications, I haven't been in over a year. It's been a fabulous 12 months. I feel younger every day as I roll into my 50th birthday next month. And at this point, I'm gonna just pause, and I'll see if there's any questions. More I can share if you want.
Perfect. Thank you for that. It's truly remarkable story, and we'll go into some of these questions that we've had now. But I just want to quickly thank Dr. Selzner, Chantal, and Elena for the great informative talk earlier about the transplant process. It's a pretty common, I find, a lot of common questions that kind of arise in terms of the pathways, but also the process in general. And of course, thank you, Jefferson, for that inspiring story. We'll go just quickly kind of some of the general questions we got during the talk there. Maybe this one can be for Dr. Selzner. It has to do from a general national perspective in terms of transplant programs in the country, I guess transplant or living donor programs. Does the UHN program span outside of Ontario? For instance, those who are living in Manitoba or Atlantic provinces, or even some folks in provinces who don't have access to a specific transplant program. How would that work for perhaps folks who are outside of Ontario, or even perhaps outside of Toronto, given there's some transplant programs? Maybe if you could just kind of touch quickly on that aspect for some of our audiences that are outside of Ontario.
Yes, that's a very good question. So indeed, we offer living donor liver transplantation to provinces that don't have access locally to living donor liver transplantation, and they are recipients who are interested to donate, to receive a living donor transplant surgery. We do offer them, providing that their own province does not have a living donor liver transplantation option available to them.
Perfect, thank you. Another question, probably maybe for Chantal and Elena, with respect to the inclusion or exclusion criteria. I guess similar aspect from a national perspective. Would those criterias, for example, age, or health overall, would that generally be the same for all of the transplant centers across the country, or is that specific to UHN? And if so, perhaps why is that? Perhaps maybe the age cutoff is probably the most common question we get at the CLF is why is there a certain age cutoff for potential living liver donors?
Hi, Chantal, I can answer that. The living donor criteria is very similar in other programs, but this is our direct policy that I'm speaking about today. The 60-year-old cutoff, as people age, the liver doesn't regenerate as easily. And we do worry about liver volume. So the liver size that remains in the donor needs to be a certain amount so that the liver can regenerate safely and that they have no liver problems themselves in the future. But we do note that as people age, the cellular regeneration can be less than someone who's under that age group. Obviously, we need a cutoff age. Also, as you get in your 60s, there can be other health issues that arise. So we find, I think our median age is around 45 as well for, age 16 and up. That's obviously for consent and making sure that it's safe to proceed. And we have had some young donors in the past. It's not the norm, but we have had donors that were under the age of 18. Some other organ donation like kidney, sometimes they have an older age cutoff, but for live donor, it is 60.
Dr. Selzner, anything on your end to add to that in terms of cutoff or age or
Yeah,
risks?
perhaps I can add to the fact that actually our living donor program is in the Western countries at least is one of those that has the highest age cutoff for the donors and definitively also the lower age cutoff. A lot of US and European countries, those who obviously offers living donation have a maximum cutoff of 50 or 55, sorry, and I believe also in other province in Ontario, in Canada, that offers living donation, maybe their age cutoff is also a little bit, upper age cutoff is a little bit lower than 60.
Perfect, thank you for that. We'll have maybe one more question here with respect to that aspect. Perhaps maybe Alana can answer. In terms of anonymous living liver donors, I know you touched on it quickly in terms of the UHN team is very well involved. We've had a few inquiries come into the Canadian Liver Foundation with folks looking to donate. However, it's to nobody specific. I mean, there's nobody in their family or close network who fortunately is struggling with liver failure, but they are looking to do some good. And maybe just kind of quickly touching on that aspect from the anonymous living liver donor side, if anything you can add.
Yeah, definitely. So we have had quite a few interested anonymous living liver donors. So with their anonymous donors, they do apply the same way, and then we just review their application. With them, we always ask if they're interested in donating to an adult or a child, if they have a preference, because it would be a different lobe that they'd be donating. And if they are more interested in donating to a child, usually it's more preferable if they're on the smaller size. So like a very tall, like 6-foot man might not be suitable to donate to a child just based on size. And then, as Chantal mentioned, we also do try and have our anonymous donors 55 and under, but definitely otherwise all the criteria to be a donor is the same, and we would just kind of work them up in a normal process. And then once they've been cleared and picked an OR date, then we would proceed to surgery and the recipient team would match them with the recipient.
Wonderful, thank you. Very detailed, but sounds like a very solid process. And I think people like to hear that there's these policies and processes in play, and it's not just kind of eyes closed, and it's kind of luck and chance. So appreciate that. Thank you.
And sorry, maybe
yeah,
along the same line, I can just add that the anonymous or non-directed living donors has been really growing over the last few years, and we have done over 100 of those transplantation with this phenomenal, generous individual that come forward and are willing to donate to someone in need for liver transplantation. And we have done over 100 of them recently in the program, and it has really grown and developed their own path somehow, and it is truly mind-blowing for all of us to work with these individuals.
Perfect, thank you. We'll have one last question here for Jefferson, if possible. I guess you were kind of going through the process of this huge journey right when COVID hit, unfortunately, and maybe you can quickly explain perhaps how that journey, or how it impacted your journey with COVID, in terms of not only fear from the illness itself, but also some potential delays in healthcare delivery and other factors that have applied or have been applicable to yourself, but also to your family members.
Yeah, thanks, Sam. That's a very interesting question, or a timely question, and it's interesting now. What are we, 2 years into COVID? So it almost feels old, but I'll recall back. I was frightened at the time, I'll tell you, because this was, I won't do this sequentially, but just left it out of the walking in the hospital part. This was so this July, early COVID, everyone's masked and PPE, all this, and I was terrified and lonely because I was told my wife wouldn't be able to come in and see me. I had to go in the night before, stay overnight, and all of these things. And then I'm in the room and I'm worried if someone else comes in the room, have they, I have tested negative. They haven't been tested yet because they've been rushed in. The team is wonderful about segregating and keeping everyone safe. And obviously through the journey, I had a number of visits and nothing happened, but I just remember lying there, just feeling extra vulnerable on the eve of this big major surgery. Thankfully, the rules kind of were shifting at that time, and my wife, I got special permission. She could come in and see me that evening, and then the morning she joined me before I went down, which was great, because at that time I didn't know how many moments are left. Obviously that's a silly statement, but just going forward as COVID progressed, one of the times my wife was allowed in, thankfully, for an hour at a time, but I was in for 2 weeks. So it's pretty lonely and isolated. And I was in an isolation room at one point for various other concerns, and that's tough. And I'll just say one more. The biggest part was I was in with a collapsed lung, probably the worst of my side effects. And I was in for 2 weeks. No visitors were allowed due to the spike up in COVID at that time. And that was a very long time. Thankfully, I was, rightfully, wrongfully, maybe I shouldn't say this, I would go and I would do everything in my power to take all my apparatus downstairs, and I'd go outside and see my family at a distance, and then go back inside. And that's that little 15 minutes there, a lot of effort, but it was the only thing that made it good. So COVID certainly impacted it. I think we were delayed maybe by a month or so just for workups. I can't speak for the team. I think I heard they didn't shut down for very long because it's an important process, but all these tests that you have to go through obviously got backlogged. I will say one thing though. There was one positive COVID impact that I've heard from colleagues. They've shared with me that with the strife in the world and the way COVID is, this story that they've heard through me of humanity, and it's given them a renewed faith in humans, and a positive thing in the world. If that's relevant to the question, I don't think, but I hope that answers the question.
No, it really does. Thank you for that, Jefferson. With that final answer, we'll conclude this session, this webinar for this evening. We'll have to take the time to thank all of our wonderful panel speakers for their great talks. I want to thank, of course, our partners at the UHN Ajmera Transplant Centre, and of course, the Center for Living Organ Donation for helping with this educational webinar series. So as mentioned earlier, this webinar will be available on both the CLF and the UHN Facebook page, as well as the YouTube channel next few days. Of course, to learn more about liver disease or to find out more about the Canadian Liver Foundation, our website is liver.ca. And for information on transplant and living organ donation, as mentioned earlier, the website is the UHNtransplant.ca, and the information is on the screen there for the Facebook, Twitter, Instagram, and social media tags. Now, our next session for this series will take place September 28th. We will discuss the pre-transplant journey. So the registration link will be available on the CLF and UHN Facebook pages, but it will be also shared to those who register through the Eventbrite link, which will also be on the main promotional flyer page. So this third session will highlight, of course, the pre-transplant journey, where we will discuss the wait list. So we didn't touch too much on the wait list with either Jefferson or all of our speakers, because we want to save some of those aspects of the pre-transplant journey in terms of indications for transplant, but also the pros and cons that folks and patients and caregivers may experience in the pre-transplant journey. And then our fourth and final will be the post-transplant journey. So one last note, September 11th through the 17th, so notice a little far from now, but of course, time passes by very quickly. It was the Living Donation Week. So for those who aren't familiar with it, it's an awareness week featuring virtual events and activities focused on improving access and equity in living organ donation. And of course, profiling the work of the various team transplants and celebrating all the incredible living donors, transplant recipients, and community partners. And of course, all the stories that we've heard, and Jefferson's story along with Tim. This is why this events in this awareness week is important for events or for causes such as Jefferson and Tim's story. So I just want to thank everybody for attending, and hopefully you've gotten some good information out of this, the second session out of our quarterly webinar. Tune in for our final session, and I do want to thank you all once again for attending. Until next time, and take care.